Last time, we learned that the complex drug pricing environment encourages the use of high-cost medicines rather than low-cost competitors.
We now know why there's a drug affordability problem. There's a big difference between drug costs and the share paid by patients.
I'm confused, Professor.
Pete, the total U.S. spending on drugs is about 10% of everything we spend on healthcare. This is the same rate we spent 50 years ago. Many studies show that spending more on innovative drugs lowers costs because many won't need long hospital stays anymore.
If that's the case, Professor, why is there a patient drug affordability problem?
To answer that, Pete, we need to go to the movies and look back at our journey so far.
I've got my popcorn, Professor.
Let's watch the preview first, Pete. What patients pay depends on their insurance deductibles, co-pays, and co-insurance.
Enough previews. Let's start the movie.
Okay, Pete. Remember when we were talking about fast-growing list prices and slow-growing net prices? This does not create an affordability problem for the system, but it does for patients. Here's a scary movie, The Attack of the Growing List Prices. As list prices have grown, especially for expensive drugs, patients are seeing unaffordable drug costs, even though net costs aren't rising.
Here's the next feature, Adventure on the Prescription Escalator. It was a lot of fun riding up and down.
Not for elderly patients, Pete. Since we take more prescriptions as we age, older patients face a big affordability problem when you consider the gross price, net price issues. And remember when we talked about biosimilars, Pete?
I remember those. Those are lower cost biologic drugs, right?
Well, when the system incentivizes higher cost originator biologics, patients are exposed to thousands in costs that could be lowered by using cheaper biosimilars. Pete, today's lesson is this. The drug affordability problem affects specific patient populations. Through targeted reforms, we can achieve the twin goals of innovation and affordability.
Join us next time when we learn why price controls and drug importation will make things worse.